Great. So we are live now. So great to have everybody here. And we are here with Dr. Neil Nathan, who's just come out with a wonderful book, which I think is going to be the book of the year, or one of the books of the year. And of course, Heather Sandison may join us, who also has a book that just came out. Dr. Neil Nathan's book, I recommend it heartily to everybody right here, The Sensitive Patient's Healing Guide. And it really fills a niche because there just hasn't been not only recognition of sensitive patients and what for physicians to do with them, but also how do you treat them? What causes this? Is this a real entity? This is a very, very important landmark, I think. So, Dr. Neil Nathan, thank you so much for joining us today.
Yeah, thanks for having me, Dale. Nice to be here.
Always great to talk to you. And of course, you have consulted on many of the patients we've had with cognitive decline and been so helpful, whether they are people who happen to be sensitive, particularly sensitive, or whether they are not. So let's open this up. If you could talk a little bit, you have a great intro in the book about talking about how you kind of came to this understanding, how you started to treat your first patients, and what this is all about, and what are the things that generate this. Of course, this is an area where mainstream medicine doesn't even agree that it exists. And yet we see it all the time. It's amazing to me. Here it is. It's right in front of you, but people will deny its existence. So please tell us a little bit of the history.
Well, I've been working with mold toxicity and Lyme disease for a long time.
Mhm.
And we began to see, I would say in the early 90s, a slowly, insidiously larger group of people who would describe extreme sensitivity to anything. For example, I remember a woman who could not take the teeniest bit of progesterone or estrogen, and yet by testing, she was absolutely deficient in it and she needed it. And she wasn't, a head case. It wasn't that she was anxious or worried. She was a solid citizen. And I knew at that time that I wasn't able to help her, but I didn't know then anything like what I know now. So I have been searching ever since to help those sensitive folks, people who come in and say, I took a teeny bit of a homeopathic and I've been sick for days.
Yeah.
People who will say, I can't work in the sun without sunglasses, or I even have to wear sunglasses indoors, where the
Yeah.
slightest sound makes me jump or makes me jumpy. I can't handle that. So sensitivity to light, sound, chemicals, smells, EMF, all of those have been increasing exponentially over the last 25, 30 years. So it went from me seeing a few people in the early 90s to, in my current practice, it's just about everybody.
Yeah.
So it's gone off the rails, and the medical profession hasn't kept up with what's happening to those patients.
Right.
And so the medical profession is prone, and I apologize for this, for saying to those people, "Oh, you're just too sensitive. Toughen up.
Yeah.
Grow a pair." And that's not the case. This is not psychological. This is a nervous system in which their limbic system and their vagal system and connecting to the mast cell systems, these are hypervigilant systems. And we have learned, God bless, in the last 20 years, how to quiet those systems down and literally how to reboot it. So I wrote the book because I really felt there was a really need to reach out to these folks, and they're not few and far between.
Yes.
For example, a study was done in England just recently, which showed that 1% of the English population is disabled legally by hypersensitivities of different types. That's 1% of
Wow.
the whole population. And up to 35% of the English population has some degree of excess sensitivity that's impacting their lives. So we're not talking this is rare. I don't see this very much. It's not talked about very much.
Yeah.
Because when people are sensitive, their reaction from family, friends, physicians has been, oh, you can't be that sensitive. Come on.
Right. Yeah. Yeah. So the other interesting thing to me is when you say sensitive, It's not that the sense itself is more, in other words, it's not that you say, oh, now I can see 5 miles when I used to only be able to see a quarter mile. What it's really saying is, as you sense something, it is triggering this autonomic and this limbic response. As you point out in your book, it's a combination of limbic and vagal that really seems to be setting the tone here. And so that you're essentially saying, I am under assault. I am under threat, and my body must respond to that, which is a positive thing for your body, but it unfortunately disables you as long as you're exposed to these things. You give a really interesting example in your book of a person who was so severely affected, and even though she was starting to get better, she would be walking past someone who had their clothes that were cleaned in a certain detergent that will go unnamed, and would literally collapse on the floor. Her body just telling her, you know, it's fight or flight or faint. You're gone here. And so just amazing. And it's hard to deny, just to say, oh, this is all just a psychiatric issue. No, this is a protective response. Interestingly, we come across these same things. Amyloid is a protective response to all these insults. And so these things are all part of your body's response. So maybe you could just give us a quick list. You've mentioned a few things already. What are the things people are sensitive? You mentioned even the low thiamine in your book, for example. You mentioned EMFs. You mentioned all these different things that either you're sensitive to or that contribute to your being sensitive to. If you could kind of tell people about that.
And the sensitization process keeps going until we turn off what triggered it in the first place.
Yeah,
So the general rule is that as you become a little bit sensitive to smells, for example, then you become more sensitive to smell, then you become sensitive to light
yeah,
or sound or EMFs or food or the supplements or medications you're taking, and it begins to rocket. So many of the people that we're talking about here are limited in their diet to eating 4 to 10 foods. That's all they can eat, or they're going to react very badly.
yeah,
So all since we're talking the nervous system, it's really pretty simple. We're talking about the senses of the body,
yeah.
the sense of smell, sight, taste, touch.
Mhm.
Those can all become sensitized in this process.
Very interesting. Okay. There was a very interesting documentary recently, which is called The Quiet Epidemic. It's streaming on Amazon. I recommend it to everyone. Very interesting. And this is about chronic Lyme. And you mentioned in your book that, tick-borne things as relation to, one of the ways to get this. And the interesting part about this documentary is here you have all these data, and they had data from imaging and data from electrophysiology, and of course, patient symptoms and neurological exams and lab to everything. And yet, of course, the insurance companies said, we don't want to pay for this. So the interesting strategy was we will just deny its existence. So we'll just say there is no such thing as chronic Lyme. Of course, they looked ridiculous when long COVID came in because there are lots of similarities between these two. They both involve the immune system, the nervous system, specific microbes. These are kind of similar responses in some ways. So, talk a little bit about how did you first realize that there were things related to tick-borne illnesses? And I know you often point out that there's one organism that seems to do this more than the others. If you could talk a little bit about that.
Sure. So what we're learning is this all grew over time. I felt like I had a lot of sensitive patients and no
Mhm.
tools to deal with it.
Yeah,
So I studied it. I guess my reaction was different than other physicians who go, this is too weird. This is
yeah,
psychological. These weren't people who were psychologically unstable. These were all solid citizens, hardworking. They weren't looking for a way out of work. They just wanted to be helped. So our knowledge about this grew slowly. One of the first tools that we had was developed by Annie Hopper, and that was limbic retraining. And when I discovered limbic retraining, it was like, wow, this we can now help a huge percentage of these people to literally reboot their limbic system.
Yeah.
Then Steve Porges came out with his knowledge about the polyvagal theory and the
Yeah.
vagal component. And for me, I just put them together, which is
Yeah.
these these two systems are talking to each other. And as you talked about, it's about safety.
Yeah.
These are not deranged neurological events. These are protective mechanisms. Our brains are trying to scrutinize the stimuli that we're being exposed to from a safety perspective. And they're basically going, whoa, I don't know if what you're doing is safe. So I'm going to shut you down so that you will get out of doing what I think is not safe for you. Now, this is not a psychological process. This is neurological. And it grows over time. So the more stressful experiences you have, the more sensitized your vagal and limbic systems become to these events. Um, so that's kind of how I got into it. And in 2016, with Larry Afrin's publication of his wonderful book, Never Bet Against Occam, then we got the mast cell component to that. So
Mm-hmm.
from my perspective, the three biggies that trigger this neurological cellular protective response that's gone off the rails is limbic, vagal, and mast cell in origin.
Yeah. Very, very interesting. So how do you tell when you have a given patient how much of this is going to be vagal related, how much limbic related, how much mast cell related, and how much are there other pieces?
The simple answer is I listen.
Yeah.
People will tell me um, by their story. So to be very specific, the limbic system's primary symptoms that it will give you when it is under threat are emotional and um, and sensitization. So if someone tells me, and I ask, are you sensitive to light or sound or touch or chemicals or EMF or food? And if they say, oh yes, I have to wear sunglasses indoors, or loud noises make me startle, or if I if I smell something like a perfume or diesel fuel or gasoline or you name it, I'll immediately get a headache or brain fog or cognitive impairment from doing that. That's limbic.
Mm-hmm.
The, if someone tells me I never used to be anxious or depressed or OCD, but now I am, and I'm anxious without having a reason for it. It's not like I'm having an IRS audit or my in-laws are coming over
Yeah.
for dinner.
Right.
Um, I'm just all of a sudden in a panic attack and I'm scared and it makes no sense because it's coming out of nowhere. So any increase or startup of anxiety, depression, OCD, depersonalization, derealization, mood swings, anger, that's limbic. So literally, when someone is describing that to me, I know we've got a limbic piece to it.
Mm-hmm.
Now, the vagal symptoms will be a little different because the vagus nerve controls, amongst other things, intestinal motility. So anyone who's describing difficulty with digestion, reflux, diarrhea, constipation, especially abdominal pains and cramping, um, that's vagal. Temperature dysregulation, palpitations, insomnia. So all the things that the vagal nerve will relate to, that tells me, oh, there's a vagal piece to this.
Yeah.
And for the third part, um, that might be a little harder to figure out, mast cell activation. But if someone describes any symptom that comes on immediately after eating, that's not allergy, that's mast cell activation. Now
Mm-hmm.
I'm talking immediately. Sometimes some patients, those symptoms come on while eating.
Right.
So allergy doesn't come on that fast, but mast cell activation does. So if someone were to get palpitations, diarrhea, abdominal cramps, hives, itching, cognitive impairment, an increase in fatigue, sweating immediately, now I know you've got mast cell activation also. So it's not that hard to get a history from a patient that tells us,
Yeah.
these are things that we're going to need to work on.
Absolutely. All right. Let's welcome Heather here. Dr. Heather Sandison has joined us from her automobile. Thank you very much, Heather. And I think it's important for everyone to know Heather has just come out with her own book, Reversing Alzheimer's. It came out just a few days ago and is doing very, very well. So great to have you here, Heather. And I know that one of your teachers is here with us, Dr. Neil Nathan. So great, great to have you here. Yes, we've all got our copies of the book, which is great. So thank you.
Okay, I suppose I should hold up my copy just so
Yeah.
we're all in this together, right? Here we go.
Yeah, and as I said earlier, I really think that this fulfills a niche that is so needed. It's an area that most physicians deny its existence. It's clear that it's happening. In fact, let me just jump to Heather for a moment here. Heather, what's your guess of what percentage of the patients you see with cognitive decline actually have some degree of sensitivity to chemicals or EMFs or other things?
Yeah, it's the majority. And many people with cognitive decline are experiencing stress. Of course, as you well know, just having cognitive decline is very stressful.
Yeah.
And that can have an impact, like Dr. Nathan was talking about, on the vagal nerve, on increasing hypervigilance. And I think caregivers as well have this kind of learned sense of hypervigilance because of the stress associated with this disease. And particularly for people who have had a loved one who have experienced Alzheimer's, I think this is very underrepresented. I'm so grateful. I mean, I'm just pinching myself that I get to be here with my two mentors. I mean, just two of the people who have paved the way for me. And the clinical pieces that I've learned from each of you have been powerfully helpful and have been a lot of other doctors don't talk about them and don't give clinicians the tools to put to work in their practice. And so Dr. Nathan's just very practical approach to what works for patients. Start low, go slow. Older patients are often very sensitive. And so, and they'll respond to very small amounts of things. And I have turned back to Dr. Nathan's work over and over again to get clear guidance about how to get started, how to work with patients who don't seem to tolerate anything. And through that, I've been able to help a lot of people. And then they've gone on to help other people. So I couldn't be more grateful.
Thank you. And let's come to Julie for a moment, as I know, Julie, you've had some of your own experience with this sort of thing. If you could talk a little about your own sensitivities and how you managed to get rid of those, overcome them.
Right. As Dr. Nathan was talking, I'm going down the checklist going, yep. My sensitivity started when I was living in a moldy house. I didn't know that I was at the time. I also had a Lyme disease co-infection at the time. And no surprise, I developed mast cell activation. So I was extraordinarily fragile. I remember one time I was taking a walk around the block. This is just going to make me cry. And I was so fragile. I needed an EpiPen in case I had anaphylaxis.
Yeah.
I needed a snack in case I had hypoglycemia, water for hydration. I had to carry a wagon with all my supplies. And this was just me trying to go around the block. And of course, I had to have my husband for support. And our dog was with us, but it was ridiculous. I mean, I had been so strong and so healthy all my life. And suddenly in my very early 50s, I just completely fell apart and nobody could figure out why.
Yeah.
It was terrifying.
Yeah. Neil, let me come back to you for a minute here. One of the things that we hear about is young people, teenagers, 20-somethings, 30-somethings, who are all having this. I started calling it camelback syndrome because there would be the straw that broke the camel's back. They would have a stress from this, a stress from that, a stress. They would. One of them was she fell off her skateboard, and that was the final piece. And then she just becomes completely inactivated, just unable to do anything. She's depressed. She's got fatigue. She can't get out of bed in the morning. And this lasted for over a year. And so if you could talk a little bit about what is happening to these relatively young, healthy people who are getting this phenomenon, which seems to lead to the fatigue and the depression. And then they often have some sort of sensitivity to kind of anything going on. What is that all about?
It is the straw that breaks the camel's back.
Yeah.
From the time we're in our mother's uteruses to now, whatever now means, whatever age we're at, our nervous system is being slowly trained to deal with whatever we've had to deal with. And so none of us have had perfect childhoods. Whatever it was you had to deal with in childhood has shaped where your nervous system is right now. So let's say you had recurrent ear infections or throat infections when you were a kid. You went on lots of antibiotics. Or from a different perspective, maybe you had parents who were each working several jobs. They weren't really there for you. Conversely, maybe you had some form of abuse, emotional, sexual, or physical. Or maybe as things went along, you got mono or you got an infection of some sort. And as life progressed and you moved along in your life, you got pregnant several times and that had an effect on your body, or major surgeries, or you had losses of different types. All of these things affects our nervous system, so that we begin to look at the world not through the eyes of a safe newborn, which is, what a glorious world, this is wonderful. But we look at this world with, may not be so safe out here as I thought it was. I had better rev up my sensory perceptions to protect me so that I don't get into trouble, so I don't get my head handed to me by any number of things happening to me. So I'm going to protect myself. So this vagal limbic protection is a process.
Mhm.
If we get a certain number of things, could falling off a skateboard, an infection, COVID was a big one. COVID affected people profoundly in this way. Um, and the biggies, in my experience, I don't want to leave it out of the discussion, is mold toxicity, which Julie referred to, and Lyme disease, which you referred to.
You mentioned
One is
Bartonella.
particularly Bartonella.
Yeah.
So one is the category of environmental toxins,
Mhm.
and our world is getting increasingly toxic,
Yeah.
and different stealth infections like Lyme and Bartonella and Babesia, and some viral infections of different kinds. So these are the things that will trigger the straw that's breaking the camel's back, so that our systems, we're coping okay, we're getting by. May not be completely healthy, but we're managing in our various stressful lives. And then when the straw is hitting the camel's back, now we become non-functional. And these are, like Julie, previously very healthy, high-functioning people,
Mhm.
who all of a sudden are bedridden and they can't walk around the block. So this is a somewhat understandable process once we can understand how all this is happening to us. And I really want the audience to hear these words. And every single thing I'm talking about today is treatable. You don't have to stay stuck. We know how to treat this now.
Yeah, I think that's so critical. And if you could talk a little bit about EMF. So we hear, about EMFs all the time. Of course, people say, oh, it's all in your head. I mean, if there were a problem with this, of course, they wouldn't allow you to have Wi-Fi's and they wouldn't allow you to have your 5G and all this sort of stuff. So it must be okay. And of course, the same thing they were saying years ago about, PFAS and PFOS and all these forever chemicals. And we were saying years ago about DDT, and the same thing just echoes throughout the history. The big issue
Yeah,
has always been, how do you measure it, and how do you know when that's a problem, and how do you fix it?
well, take cigarettes as an example.
Yeah,
For years, the industry told us, oh, they're very safe. It's not a
yeah,
problem.
yeah,
We know so much better now. But in the early days of anything, the various industries that are putting out these products sugarcoat almost everything
yeah.
to the point that, okay, now we know a lot more about it. And this is no different. So, for example, when people see there's a difference between 4G and 5G, oh, it's just one number, 4 is 5.
Yeah.
No, it's 1,000-fold greater electromagnetic frequency exposure. And it has affected the lives of people. It's more of an epidemic than people realize.
Yeah.
So that do Verizon and AT&T want you to know about this? No, this is
Yeah.
the greatest thing. We have 10G coming on
Yeah.
board very soon. This is exciting. Speeds unheard of. At what expense? So again, depending on the nervous system of someone involved, not psychological, depending on how that nervous system has become wired, many people are not able to handle the radiation they get. Now we can measure it. It's not hard. There's a device you can buy from Amazon for less than $200 called a smog meter. And you can simply, it will measure 3 different kinds of EMFs. Just click the dial and you just hold it up against your body and see, what am I getting exposed to? The computer that's in front of me, how much am I getting? My cell phone, what am I getting? The electrical devices in my home, what am I getting? And you can actually read it. And it'll read it in colors. So green is okay, we're good. And then we have yellow, orange, and obviously red means, okay, now you're really getting exposed. The simple way to know if it's bothering you is, do you have symptoms when you're using your devices for a prolonged period of time? A lot of people will become cognitively impaired after they've been on the computer for various periods of time. For really sensitive people, could be 2 minutes. For
Right.
other people, a couple of hours. So some people will get headaches, fatigue, cognitive impairment, or actually neurological issues like pseudo seizures or
Yeah.
dyskinesias, which are kind of writhing, twisting motions when they have that exposure. It's a very real thing, and it's not in people's heads.
Yeah. So one of the very practical things is if someone out there is saying, I seem to have this, I'm sensitive to this chemical or this smell or what have you, they don't know how to get started. And if they go to their doctor, I hear this all the time. I went to my doctor and I asked them what to do about my cognition, and they said nothing. Sadly, a common one I hear is I'm having clear cognitive issues, but my doctor said it's just normal aging. And then they keep saying that until the person is, well along in their Alzheimer's. Very unfortunate. So how does someone get started if they believe that they have sensitivities to chemicals or EMFs or other things?
Very simply, I don't want to be self-serving here, but please read my book.
Yeah, I guess that'd be the start.
Yeah, yeah, yeah. Please read my book.
Okay.
If you think this is happening, trust yourself. Number one, absolutely trust what you know about yourself. If I mean, most people after a while look at the television set and go, "What's that actor's name? I should know that actor's name."
Yeah.
That's okay, but there's a different cognitive impairment when you know, I'm not remembering words that I should know.
Right.
I'm not coming up with the language that I need to know. We call that word finding.
Yeah.
There, the when you know that you're not operating at your peak efficiency, please get yourself tested because this is the perfect time to get treatment. And as you well know, Dale and Heather and Julie, that if we treat to catch this early and we can figure out what is inflaming the body, what then we can treat that specifically. Could be mold, could be Lyme, could be a hormonal imbalance, could be any of dozens of biochemical deficiencies that you've measured and talked about in your books, Dale,
Yeah.
that look for them. They're fixable, they're treatable. And if you catch it early, then you don't have to have that impairment later on in life. And I know that all of us here on this podcast here would agree. We catch it early, I think it is completely fixable. You catch it later, much less fixable. Some of those neurological patterns are becoming entrenched. They're not as reversible. So
Right.
if you have a question, and I know you're saying the same thing, get it looked at early. Don't blow it off.
Yeah. We talk a lot about prevention, of course, when we talk about cognition. Are there things that people should be doing in terms of prevention when it comes to developing these sensitivities?
Um, the simplest thing I think of is eat organic.
Yep.
Um, get the cleanest water and air that you can breathe possible,
Yeah.
get exercise on a regular basis, be sure your sleep is healthy and restorative. I mean, those are super basics in
Yeah.
a great way of thinking about it.
Great. And then Heather, let's come to you for a moment. If you could talk about in your patients where you've treated that do have some degree of sensitivity to one thing or another, what are some of the things that have worked that you've seen to work the best for helping them?
I used to start doing Gupta or primal trust or DNRS later in the process.
Yeah.
But at Dr. Nathan's suggestion and through my clinical experience, I noticed that starting that earliest was actually the most beneficial. And I now tell people I'm offended if they're not resistant, because everyone is resistant to this idea of sitting down every day and being diligent and disciplined about getting in the neural retraining. And yet I have yet to see a patient who's fully recovered and isn't consistently triggered easily if they haven't done some type of neural retraining or another. And so I do the limbic retraining. And so I do recommend that early on. I emphasize it much more than I used to. And then, of course, I believe that 75% of environmental illness is identifying and avoiding the toxic exposure. And so that can go a long way in reducing the burden, the toxic burden, and that triggering cycle that patients get into. So although there's lots of binders and the mast cell stabilizers are very, very helpful, I am so grateful to Dr. Nathan for teaching me how to guide patients through determining which mast cell stabilizers are going to work for them. I suggest that patients, as they're looking at them and thinking through the different mechanisms of antihistamines or H1, H2 blockers, the herbs that we can use, the different pathways that we can get out there, the tryptase inhibitors, that they systematically say, does this help me, hurt me, or is it neutral? And not with any sort of judgment, just curiosity. And so starting with a few of these things, particularly the limbic retraining, I think is really important. And with cognitively declined patients, I think that this can help them to refrain their experience of the disease process and what they're going through, and especially when they do it with their care partner. After we did the clinical trial in my office, I chatted with Ashok Gupta, and I said then, next time I do a trial, I want the Gupta program to be part of the trial for the participant and for the caregiver, because I do think that limbic retraining, almost everyone should have access to that. We should all learn the power that we have to retrain the system, so that the brain plays such a big role in how we physiologically respond to things in the environment. And when we realize that we have control over that, it's so empowering.
Yeah, that's a good point. So this is one of the things that intrigued me also about your book, Neil. You talk about all the sensitivities, all the way that you get into this. But when we're looking at literally the molecular biology of Alzheimer's disease, you see an analogy here where you see a switch that has two modes, which is a connection mode and a protection mode. So what I'm wondering is how many of the people that we are seeing with cognitive decline that don't endorse anything, they don't have a sensitivity that they know about, and yet they may do better if we include this treatment, because we're trying to change that nervous system response. We already know the nervous system is telling us, I'm in a protective mode. I'm no longer in the connection mode. I'm in the protection mode. I'm making amyloid. I'm making tau. I'm trying to kill the microbes. I'm trying to respond to insults. It would only make sense that they would have limbic abnormalities. And by the way, of course, we know their limbic system neuropathologically is abnormal. So I'm very interested to see how many of these, who I would say, not as good responders to the things that we have been doing to optimize the biochemistry, may end up doing better if they had DNRS or the Gupta program or some of these other things. As a scientist, I used to think, stuff like this was too woo-woo, and I just have to measure the molecules. But the reality is this is turning out to be so, so important. So this is fantastic. Again, I think this is a landmark book that's going to help so many people. Neil, you were to say something.
I have a thought as you're speaking. I was thinking that most people think about the vagal system as being fight or flight.
Yeah.
So, but there's another one which Stephen Porges has taught us, and that's immobilization or freezing. Yes. And as you're speaking, I'm thinking, we've been thinking about introducing our patients to limbic if they are scared or frightened or in the flight mode.
Right.
But many of our cognitively impaired patients are probably in freeze mode.
Exactly.
And that's so as you're saying that, I'm thinking that doesn't show up in discussions with people as much, because if you're frozen, you're not talking about being frozen. You're just immobilized by indecision or by it may look like something else. So I think it would be really fascinating to do, and I think Ashok Gupta would be open to it, and maybe Annie as well.
Yeah.
Let's. I don't believe anyone has studied it so far, but take a group of Alzheimer's patients and get them all trained, and you could have sort of a control group that didn't get the training and compare that to a group of people that got the training. I think what we're all talking about is, I suspect that the people who got the training would do better.
Absolutely. We've got some great questions here. And if everyone has a few more minutes, let's go through some of these questions. So let's see here. Michelle is asking, I have had Lyme disease for 27 years, sensitive to chemicals, EMFs, and others. Recently, it's been found I have extremely high levels of arsenic. Charts would need to be over 3 times higher to even show my level. Wow, which has made my condition beyond challenging. Okay. Have you seen arsenic as a common contributor to this problem? I mean, obviously she had Lyme as well.
Not commonly, but of course it can. And some people are not aware that in many cities in this country, in many areas, there's an unacceptable amount of arsenic in the drinking water.
Right.
So for her specifically, please get your water analyzed to know whether that's not your source. But you can chelate arsenic out of the body.
Yeah.
I more often see mercury and lead as the metal toxins that affect people cognitively, but certainly you can be arsenic.
Yeah, great. Next one here says, Carol says, I just read this today. Can you comment weekly consumption of a modest number of eggs, which are a good source of choline associated with a dramatic reduction in the risk of Alzheimer's disease in a recent study, choline supplements? Yes, so we have all been suggesting choline forever. The Americans tend to be a little low. They tend to get about 300 to 350 milligrams a day. You should be up more like 450 or 550. We've been suggesting pastured eggs, of course. Not your routine run-of-the-mill dirty eggs. We've been suggesting citicoline, alpha GPC. There are lots of ways to get choline. So yeah, absolutely makes total sense. I have not seen that particular study. It sounds like it just came out, but I look forward to reading it. Let's see, the next one here is, could you speak to patients with CCI and or TOS where a primary driver may be persistent misalignment of the craniocervical junction and your approach to treatment? So Neil, I know you've talked about craniosacral therapy in the past.
We have, and I think there's an increasing interest in cervical cranial instability, which is what CCI is. It basically means that the ligaments at the base of the skull have become somewhat looser. You will see it in people with EDS and Ehlers-Danlos syndrome. And we're also learning that Ehlers-Danlos is not just genetic, but it can be triggered by the inflammatory materials released by mast cells. So you can get a mast cell related loosening of the ligaments, CCI, compression of various structures at the base of the skull, which can be related to chronic fatigue, fibromyalgia, and also these sensitivities. So these are slowly, increasingly being known as something that is distinctly there.
Interesting, yeah. And Julie, I know you've talked a lot in the past about EDS. You want to weigh in on EDS?
Well, yeah, my family has a connective tissue disorder. Ehlers-Danlos syndrome type 3 is kind of what they call everybody if they can't figure it out.
Mm-hmm.
One of my brothers was positively identified as having Louis Dietz syndrome type 3, and I tested negative for that, but they're still looking for something else. So they're calling it EDS. But I see, and in my community at APOE4.info, we see a lot of overlap with EDS and mast cell activation. They just tend to go hand in hand, whether it's genetic or triggered by inflammation. I think we just don't know.
Yeah, interesting. And
Yeah,
you mentioned,
there's a chapter in my new book, which I wrote with Andrew Maxwell, who has proposed what's called the spiky leaky theory, which goes into the biochemistry and physiology of how cervical cranial instability leads to some of these complicated domino effects down the road. And folks might be interested in that particular chapter.
yeah. And then Heather, let's come to you for a moment. If you could comment on your patients and EDS, and then I would add for everyone, I think we should note Heather has started a couple of years ago now, right just as the pandemic was starting, Marama, which is the first assisted living facility, as far as I know, in the world, that utilizes this precision medicine approach to cognitive decline. And as if you could perhaps mention, you have someone recently who's literally come in, treated for 6 months, and it was now scoring perfect 30s and was able to go home. And this, as far as I know, this is unprecedented at assisted living. So I would strongly recommend for everyone Marama as a fantastic assisted living place. It's down in Vista, just near San Diego. And Heather.
Yeah, thank you. And I'm actually on my way to the airport to go to Kansas, where our sister facility is.
Great.
We have an open house and several speaking engagements happening there to share that there is this second location where we're accepting new residents. And yes, we have at that particular location, we've had 6 residents living there in our community for over 6 months, and 5 of them improved their MOCA scores in the 6 months that they've been there. So we have shown that we can replicate this. We can do this in other facilities. I don't have to be down the street in order for it to work, that there is a process that we can use to immerse people in the lifestyle that is organic food, like Dr. Nathan mentioned, that where we make sure the Wi-Fi is turned off at night. There's no EMFs when you're sleeping. We try to limit the EMFs. We limit even in the atmosphere and in the environment. We're limiting the noise, the distracting noise or the irritating noises. I remember when I first walked into Marama before we had taken over the facility, the very first time I walked in there were 3 TVs on. And one was playing a sports game with a whistle, and the other was an advertisement that was really loud. The other was a news station, and I couldn't hear myself think. And so just really consciously and mindfully thinking about our environments, whether it's EMF exposure, mold exposure, or just these little things that we have control over, like clutter or other environmental considerations that can help our brain feel more at ease, calmer, help our limbic system relax. So that we can be creative and have fulfilling lives. This is such a rich conversation. I'm so grateful to be here.
Great to have you here. Next question here is for those who have reacted to mostly all foods, who are not okay with taking medications to lower immune reaction. What are some things to give them hope to be able to eat like the rest of the world again? Neil, when you've got someone who's got such tremendous sensitivities, where do you start?
We start with the trifecta. We start with limbic, vagal, and mast cell retraining. With someone with that kind of sensitivity, they might not be able to start with mast cell supplements until they've done a good 6 to 8 weeks or longer of limbic and retraining first. Then they can go into that. There are a couple of other nice things that people can do that will sometimes help to restore that. NAET is a method that's helped a lot of people with food. LDI, low-dose antigen therapy, can help some people with that. So there are some specifics that can help. But I want to emphasize that with someone with that degree of sensitivity, be sure you look for what is causing all of that. Meaning, look for mold toxicity, look for Lyme disease, look for other imbalances in the body, because with a patient like that, there's something else triggering it all. And you can do your limbic retraining and mast cells work, but it's a Band-Aid until you actually get to the root cause of what's triggering it in the first place.
Yeah, it's a great point. I know years ago, our daughter was diagnosed with early lupus, and we took her to some world experts on lupus who said, we got nothing to offer. She's going to have to take steroids at some point. We then took her to Dr. Wendy Ellis, who's an excellent naturopathic physician, who said, oh, I know what this is. This is leaky gut. She had she was sensitive to everything. She said, look, just start with gluten and dairy. And she did very well and recovered and did beautifully and no longer tests positive for lupus. and no longer really has the symptoms of lupus. So very happy about that. So sometimes, you just have to start somewhere to get things going.
Yeah.
Let's see here. Are there certain healthy life pillars that, when given serious effort, can lead to hypersensitive persons improving their immune tolerance at faster rates? What are these levers to pull?
I'm going to come back to my trifecta.
Yeah.
And again, that's the most obvious big pieces involved. But in my book, there's some other pieces that may need to be looked at along the line as well. Many people who become sensitive to oxalates. Many become sensitive to salicylates. Many people have structural imbalances in their body. We mentioned CCI, but jaw dysfunction can trigger this as well. Withdrawal from various medications can trigger this type of a process. So I wanted to oversimplify it for this discussion, but for each individual patient, you may have to look at other things as well. And I want to come back to my comment, which is everything I'm talking about is treatable if you look deeply enough into the system to figure out what needs to be addressed.
Yeah. And are you a fan, and Heather, are you a fan of low-dose naltrexone? Is LDN something that you use frequently or no?
You're muted, Heather.
I'm so sorry.
Oh, yeah.
I'm in the sun and my phone shut down because it got way too hot. Excuse me.
Yes.
What a day. So LDN is something that I use regularly. It's one of those things where it can either help with sleep and sometimes it can impair people's sleep. So I usually start it at night for people, and typically it'll help someone sleep better. However, if it interferes with their sleep, I'll do it in the morning. It can also cause GI upset, and so if it does that, I tend to shy away from it. But I feel so lucky we have this armamentarium. We have a bunch of things that we can use. PEA is one of my favorites. It helps to reduce neuroinflammation. I like to use an ultra-micronized PEA. But in terms of LDN, there are many of my patients love it. So it's definitely something that I like to try. And I usually start with 1 milligram for really sensitive patients. I'll start with 1/4 milligram or 1/2 milligram. And a lot of people say, oh, the LDN dose you want to get to is 4.5. However, I've had patients who stay at 1 milligram, get benefits, and just stay at that dose long term. And that's what works for them. So I'm not as attached as I used to be around the dosing of LDN.
Got it. Okay. All right. And then let's see, there's one here. Can you speak to hormone blocker meds after a cancer journey? I've taken 4 and had large reactions and symptoms from blurred vision, clot symptoms of swelling in legs, all joints aching. Also had Lyme in the past and other chemical sensitivities. Is having Lyme part of the sensitivity? Well, you've already mentioned that. And then are compounded hormone blockers different? Neil, what has been your experience with people who've been on essentially anti-estrogens and things like that?
That's a complicated question because we're talking not about just sensitivity, but we're also talking about side effects, which these medications have. So you have to tease apart the side effects from these hormone blockers from becoming sensitive to them. And that's not exactly the same subject. So again, each patient would have to be looked at separately in terms of what they can tolerate, what they can handle, and weigh the risk benefits of it. I've had a number of patients on those blockers where they were taking it kind of as an insurance so that maybe they wouldn't get a recurrence of their cancer, but their life was so miserable taking it that you have to question, do you need this insurance policy? You may be cured of cancer already. But one thing I know for sure is that this medication is making you so sick that life's not worth living. Right. So you have to really question the pros and cons of what you're taking and why.
Got it. Next one here is from Wesley, who says, can Neil repeat the titles and authors of the various books that have informed his thinking? Well, I'm sure there are many of them. Maybe you could mention a top 2 or 3 or something. things
Oh
that
boy,
have helped inform your thinking over the years?
you guys have no idea how voraciously I read. So that is a very hard question. Um, First, since I have a chance here, I don't get a chance to see Heather very often. I want to congratulate and really appreciate how wonderful it is you've got this book written. I've already ordered my copies, so absolute kudos to you for doing that. And I just want to be able to get that in while we're still together here. An answer of books that I like. First of all, there's a fabulous new book by Stephen Porges, which he wrote with his son, Seth, which is super readable. It's called Our Polyvagal World. It's a wonderful way to understand what this is and how to understand it. I'll refer back, a book that changed my life was Larry Afrin's book, Never Bet Against Occam, which is a comprehensive understanding of mast cell activation. I'll give you some kudos, Dale. I think your book, The End of Alzheimer's, is a fabulous book and very much worth reading. Rich Horowitz's books on Lyme disease, Why Can't I Get Well, are excellent and a wonderful overview to the subject. Honestly, there's not that much written about mold toxicity at this point,
Yeah.
other than mine, which is toxic and at the risk of being self-serving. I would suggest people read Toxic to get an overview of it. And those are just the beginning. In my new book, there are references in every chapter for other books that you can get into and work your way through.
Yeah, great point. All right, thank you very much. And for those who like to see documentaries, I was so surprised to see The Quiet Epidemic, of course, with Dr. Horowitz, where the mainstream is literally denying the existence of a disease. Just bizarre. And then The Living Proof is another one about multiple sclerosis. And again, same story. They're denial of something that's obviously helping. And actually, in one of the interviewees is Dr. Terry Walls. When she was earlier, and she's actually doing better now than she was then. That was kind of halfway through. So very interesting to see, and very interesting that these things that, as you've described, both of you have described, that are really not being embraced by mainstream medicine to the detriment of patients' health, unfortunately. All right, we're running up against the time here, but let's take one or two more questions. Here's one that says, psychiatric conditions like the different bipolar types, schizophrenia, multiple personality disorder, BPD, and all the things they can do to move the needle when drugs are simply not making the change. Hoppers, Guptas, Primal Trust, are there other therapeutics for these? And of course, Christopher Palmer has just written a nice book as well on brain energy and the whole issue of psychiatric illness related to energy insufficiency. What are other things you use besides those?
I don't know. Is that one for me?
Yeah, that's for both of you.
Okay. I want to come back to look for the root cause. So with anyone who has a psychiatric condition not responding to medications, look for mold toxicity, Lyme disease, Bartonella, Babesia, unexplained, various chlamydia species can do it, mycoplasma species can do it. Look for other biochemical issues. Dr. Walsh has a wonderful book called Nutrient Power, in which he talks about many psychiatric conditions being related to methylation dysfunction, cryptoperols, zinc and copper imbalances in the body. So there's a lot coming out about psychiatric conditions that not just using medications to cover it up like a Band-Aid or make it better. Not that those aren't helpful, and they are, but to not be satisfied with that, but to look deeper and go, what could be triggering this? Because again, I can't say it often enough, look for cause.
Yeah, and we were talking earlier before coming on about the idea that 20th century medicine was about what, 21st century medicine is about why. We were all taught to diagnose things. What is it? Is it Alzheimer's? Is it Parkinson's, Lewy body, what have you? Now we need to understand why it is. What are all the things that contributed? Why do you have this condition? Because it gives you much better outcomes. And yet, unfortunately, in most cases, people are not asking what's actually causing the problem. And unfortunately, it's time consuming, it's difficult, it's not set up to interact with the current way that medicine is reimbursed, unfortunately. So we need to have a fundamental shift. And your book is going to be an important part of that shift. Both of your books, Reversing Alzheimer's from Heather, and this one, Sensitive Patients Healing Guide from Dr. Neil Nathan. So Dr. Nathan, great to see you. Dr. Sanderson, great to see you. Julie Gregory, great to see you. Thank you to everyone for being on today. And I really hope that this is going to help. Both of these books are going to help to change medicine and get a lot better outcomes for patients. All right. Thanks.
Take care.
Thank you all. Be
Okay,
well.
take care, everybody.